Hello, I'm Dr. Tom Hite with CardioSound. I'm a board-certified lipidologist in Atlanta. I want to talk about why heart attacks are so dangerous. A heart attack is really one of the most dangerous things that can happen to you. Even after you survive the heart attack, it continues to be dangerous for years. Why is that true? Why are heart attacks so dangerous? Well, there's several reasons, but today I want to talk about just one reason they're so dangerous, and it's this. Heart attack survivors are not being told about the risks they face. Here's what they don't tell you when you leave the hospital. They don't tell you, usually, the statistics. And they ought to. After you survive a heart attack, they ought to tell you just what a precarious situation you're in. But the last thing we want to do is for a heart attack patient to get stressed out, right? We don't want to cause undue anxiety. So we don't usually tell you what the statistics say about your chances. What do we tell people? Well, you survived your heart attack. Don't worry. Just take these medications. You'll be safe if you take a statin and if you take a blood pressure pill and a blood thinner. Here's what they don't tell you when you leave the hospital. Heart attack survivors have a high risk of having another heart attack. And the next one can be fatal. Now, compared to men, women are more likely to die in the first few weeks after a heart attack, more likely to die within the first year and in the first 5 years. Here are the survival statistics, and they're not easy to hear. But if you've survived a heart attack, you need to know this. 1 of 10 heart attack survivors die in the first 30 days. What about 1 year? Of heart attack survivors 45 and older, about 1 of 4 women and 1 of 5 men will die within 1 year. What's the 5-year risk? About 1 of 2 women and 1 of 3 men will not survive 5 years. What about 8 years? About 65% of women and 1 of 2 men will die within 8 years. We have a 100% survival rate during the first year and within the first 5 years after the heart attack. And one of the reasons that we can talk about our statistics is this. We tell people the statistics. We tell them they're in the fight of their life. We tell them they have a window, an opportunity to change the course of their lives. We want them to know what a precarious situation they're in. Why? Because patients who engage with the risks they face are the ones who then engage with the hard decisions they need to make in order to heal their arteries and protect their health.